Alright, my name's Amanda and I'll be your student nurse today. And I'll be doing your head to toe assessment and it'll be 15 minutes or longer. Is that okay with you?
Yes.
Okay, can you state your name and date of birth for me?
02/15/97.
Alright. And Mr. Slade, do you have any
Slade Sykes too, that's my name.
Okay, and do you have any allergies?
Amoxicillin.
Okay, any other drug allergies?
No.
You allergic to latex gloves?
No.
Any other food allergies?
No.
Alright, I'm gonna go ahead and wash my hands. Alright, Mr. Slade, are you comfortable?
Yes.
Okay. I've already assessed the, I'm going to go ahead and pull this curtain, sorry. And then I've already assessed the patient's vital signs and they were normal. The patient has a good mood and affect. His facial expressions are normal. He's dressed appropriately for the situation. He has good hygiene. He's clean. Mr. Sykes, can you state who the president is and what year it is?
Donald Trump in 2020.
Okay, and the patient is AAO times 4. Now we'll inspect your skin. The patient's skin is pink and it is warm to touch. And he has appropriate skin turgor. Next, I will be doing, also, before we started this, the patient was already assessed for pressure areas and he has none at all whatsoever. Next, I'm going to inspect your head, okay, sir? So I'm just going to be feeling around, and I feel no nodules or anything, any deformities present. Gonna feel your neck too. Nothing here either. Alright. Can you back down for me? Alright, that's all good. And next I'm going to get my pen light out and I'm going to have you look at me, sir. And I'm going to shine a light in your eyes, okay? Alright. Perla with 2 millimeters bilaterally, and then I'm going to have you fold this with just your eyes, okay?
Okay.
Don't move your head. And he does have accommodation. The patient is able to respond to all my questions, so he can obviously hear me. Next, I'm going to look in your nose, okay, sir?
Okay.
His nostril, it's clear and it's dry and regular. Can you open your mouth for me? Pink and moist and no sores. Alright. Next, I am going to listen to your lungs, okay? And on the front, I'll be listening posterior and anteriorly. And posteriorly, there's 5 spots, so each time I move it, can you please take a deep breath in and out for me, okay? And starting now. Okay, his lung sounds were clear and his breath sounds are even and unlabored. I'm going to have you turn your back. I'm going to have you turn this way and go back facing that way. And there's 9 spots back here. So you ready? Alright. And the patient is clear anteriorly too. Next, I'm going to have you turn back around for me. And then I'm going to observe the patient's chest. And I already looked at it. Anteriorly and posteriorly, he's symmetrical. Next, I am going to listen to your heart, if you don't care. I'm going to be listening to aortic, pulmonic, tricuspid, and mitral, and the S1 and S2 were heard. And now now I will palpate the patient's arteries. First off, I'm going to do the carotid. And I would do that bilaterally, and I give it a +2. Next, I'm going to do your brachial artery. I also give that a +2, and I would do that bilaterally. Next, I'm going to do your radial. Watch, okay. I'll also give that a +2. And I would do that bilaterally. Can you lay back for me, sir, so I can check your femoral artery? And this is right up here by your groin, so don't feel alarmed, okay?
Oh, I won't.
Okay. And I would feel right here. And I give that a +2. And while I'm doing this, I don't think I said this earlier, I would have gloves on, obviously. Next, I'm going to palpate your dorsalis pedis. I'm going to hold his foot up so y'all can see. And it's right here. And I would give that a +2 also. Alright, if you want to go ahead and sit back up for me, sir. Next off, I would, after checking his arteries, and they were all good, and they all sounded good, while I was down here, I would check for edema on his legs, and I see nothing present. Then I would check his capillary refill going along with the heart, and I would check out his nails too while I was doing this. His capillary refill is less than 3 seconds, so that's good, and I would check every finger, obviously. On his hands, I see no deformities, no clubbing, it's normal. Next off, I would ask the patient, so how's your voiding and your bowel movement, sir?
Good.
Okay, what color is your urine?
White. Clear.
Okay, what about your bowel movements? Are they solid, soft, runny? How's that?
Solid.
Okay, and are you going normally?
Yes.
Okay, next off, I would have you lay back, and I would actually palpate I would look at his abdomen, and I would say it was round, and then I'd have him lay back, and I'm going to palpate your abdomen, okay, in all 4 quadrants, and no tenderness or distension was reported. So now I'm going to listen to your bowel move, or quadrant, sorry. And they're all 4 hyperactive in all 4 quadrants. Next, I would, can I have you sit back up, sir? Sorry. Now I'm going to test out your strength, so if you could squeeze my fingers for me, okay? Give that a +4. Give that a +4. And now we're going to do flexion and extension. Okay. Okay, so flexion would be pulling your arm back, and extension would be straightening it out, okay?
Mm-hmm.
And so abduction would be like abducting away from your body. So I'm going to turn this away from your body, and then you're going to flex and extend, and that's good. And then abduction, we're going to turn it this way towards your body, and then we're going to flex and extend. And I would do that bilaterally, but it's normal. And then I would also do range of motion. So, for instance, for the upper extremity, you can do your head. So can you just turn your head like this for me? Okay, his range of motion is normal. Next, I would check out his strength of his lower extremity. So if you lay back for me and scoot back on the bed a little bit so I can see your legs. Alright, I'm going to hold him up a little bit, and then I'm going to push against you, and I want you to push back. Alright, I give that a +4, and now we're going to do flexion and extension and abduction of your knees, okay?
Mm-hmm.
Alright, so flexion, extension, adduction, flexion, extension, abduction, flexion, extension, and it's all normal. Now I'm going to have you sit back up for me, okay, son? And now I'm going to, obviously he's able to follow commands. I'm going to do the sensation part. So I'm gonna have you close your eyes, and I want you to tell me if it's soft or hard, okay?
Mm-hmm.
To touch. And I'm gonna do it in your lower extremities and upper. Okay, so soft or hard?
Soft.
Okay.
Soft. Hard. Soft. Hard.
Okay, his upper extremities are good. Now I'm gonna do your lower extremities.
Hard. Soft. Hard. Soft.
that was normal. And then after doing all of that, I'm not actually going to demonstrate it today, but you would check out the patient's breast, whether it being a man or female, and you want to inspect for dimpling, induration, or bulging of the breast. And you also would have them either put their hands on their hip. You're going to have them do all these. Put their hands on their hips, raise their arms up, put their palms together, and have them lean forward. And the way you really palpate this is with a systematic, it's in a systematic manner, and it's called the vertical strip pattern. And you really want to be looking for that axillary tail of Spence, because that's where the cancer usually is. Okay, and this includes our head to toe assessment. Thank you.